technologies and tools, but it's an extreme effort to apply them at the population level and make them accepted at community level. So I would like to introduce you to how we are working on connecting medical care with welfare and social care via digital health initiatives designed to reinforce intersectoral collaboration and increase the participation of people in their care. By the introduction of goal-oriented care and how Flanders will work towards the uptake of digital health initiatives. Our contribution will focus on the strategy that we are implementing to reach goal-oriented care via digitalization, a priority of the Flemish government. There are two of us here today. Hanne Verheust is pharmacist, policy advisor and project manager of the Alivia project, and she can explain you how the concrete rollout has been going on. I'm Tom de Boek. I'm head of the section of primary care and specialized care. We employ about 55 people and we manage a budget of around 1 billion euros. The hospital sector, primary care, mental health care, as well as welfare and rehabilitation are all managed by our section. The first question is, why is there such a need to transition to more integrated care as an organizational form? It's a no-brainer, I think. Everybody knows these factors because of an aging population, silvering even, more chronic conditions, and thus long-term, often very complex care processes, more empowered citizens and patients, changed family situation, more singles, more smaller families, more diversity in society, fragmented supply and market forces and capacity shortages in care. So our current care system is no longer up to the many care needs in society. So we need to drastically rethink our healthcare system. And our focus is looking at the person in all his aspects. We start from the person at the center of his care process and depart from his possibilities, opportunities, wishes and needs. Needs rather than starting from his problems, and can no longer do so. So that means a more positive approach to health and well-being. A second is that if we want to approach that person as a whole, from his capabilities and opportunities, we then also need to look at what is important for that person. What does that person get up for in the morning? What does that person wants to achieve in his life? In other words, life goals. To those life goals, we try to connect care and support goals, and we call this approach goal-oriented care. This means that we have to work in a much more planned and coordinated way than before. Because goal-oriented care also means working on goals together. It's important that the person himself becomes an active participant in his care process and also starts cooperating in the realization of the care and support goals. The persoon, in Dutch, is the person with a care need, forms a full and inherent part of the care team, both the informal and professional caregiver. And then we get interdisciplinary collaboration around the care and support goals. Consultation and coordination is very important in this kind of goal-oriented care. Thank you. So, we need to drastically rethink the organization of our healthcare system. If we want to approach our person holistically, we need to connect life domains around the citizens. This approach we call integrated care. By putting the right people on the right spot with the right task adapted to the specific needs of the person, we believe we gain efficiency and quality. And if we really want to achieve goal-oriented care, we need to work on a number of building blocks. You see them on this screen. We have to develop a methodology, work on education and knowledge sharing, assign clear roles and tasks, but also develop the right ecosystem with a role for our care boards in Flanders, Vivel, as the Flemish Institute for Primary Care, the government itself, and so on. Next, providing the correct funding and regulations resulting in a level playing field is also crucial. Note that due to organization of Belgian healthcare and the various state reforms, we do not have all the money in one hand. So bundled payments are not possible for this moment. Ideally, that would be the case. But in the meantime, we develop the right tools and connect the data to make goal-oriented care happen. We started with developing Alivia 11 months ago, and Hanne will talk you through this new application. So in a way, and that's important, from the little Flanders, we tried to change something, and we hope Alivia will be used toward goal-oriented care, but deep down, I hope Alivia will also work as a driver to push through this necessary transformation, and that is the redesign of our care and welfare organization. Hanne, you have the floor.
Thank you, Tom. So, zooming in on Alivia, what is Alivia? It's a digital tool to promote goal-oriented and integrated care, as Tom told you about. It's really innovative. Why specifically? It's a digital tool. We have our patient in control of its own digital care plan. So that's a first here in Flanders, definitely. The patient can put together a care team, including the traditional healthcare professionals, but also social caregivers, and we see and try to obtain the informal caregiver as an equal partner. It will be possible to work interdisciplinary in care planning, and all care team members can communicate in transparency of all members, including the patient. So that's new as well. Really important in the implementation of change is the support of the end user and the MISO advocacy groups and organization. It is the first time with Alivia that we have an intensive co-creative approach. For Alivia, we started in 2018 with academic research about goal-oriented care, life goals, as mentioned before. We made business analysis, we had interviews with all relevant sectors regarding the tool. Since 1 year and a half, we organize meetings with different enthusiast stakeholders such as care organizations, professional caregivers, other policies and patients. There we zoom in on different topics and modules in the application and also linking to interdisciplinary care planning. Quarterly, there is a general feedback on the evolution of development of Alivia and the latest news. We started recently a trajectory in academic support and validation for care planning in Alivia. If I can show you, it's a Dutch movie we haven't translated, but that's a view for the moment. We have a minimal viable product who will go live normally the end of January next year. We have 5 main modules, so we can put together life goals, we can put together a care team. From the life goals, you can set up care goals and care tasks linked to it, and there is a possibility for communication, all in one tool. Oh, and it's on repeat. So, we will pilot this. I will go in detail next, but we have the web version and the native app, so that's also a plus if you want to just not only use it for care planning, but also for the daily work as a professional, as a caregiver, as a patient. So I think that's a nice pro as well, but it's under construction. If we zoom in on the pilots, we will start piloting Alivia in its minimal viable product the end of March next year. In Flanders, we have selected 2 enthusiastic regions, the favorite region of Tom, Antwerp, and Southwest Flanders. And that's the minister's one, yes. During 6 months, 40 patients in both regions with their chosen care team, so they can choose them themselves, will test Alivia. We focus on patients in intensive home care situations and palliative situations. That's just a random start, but we need to start somewhere. Those specific situations involve complexity, the need of care planning, and interdisciplinary teams. So that's a really important one to have a good pilot as first. During the pilot, we challenge mainly the tool. If you remember the figure of Tom earlier, the circle, the ecosystem and role defining is more fixed due to the pilot setup. And we provide education regarding goal-oriented and interdisciplinary care to all users in the pilot. So after 6 months, normally the end of September next year, we wrap up and we will try to learn maximally for the next development of Alivia, technical, but we will also learn methodically about goal-oriented care. You see 2 pictures of the both regions because we did usability tests a couple of weeks ago and they liked it, so we're happy. Next steps. It's a difficult story. I will try to be short, but there can be questions, of course. Next up. It's an iterative development process in general, but specifically also a development process in Alivia. We have to make sure that all building blocks click in at the same time together. So at the moment we're in the orange part and the Alivia tool part, but if there are changes in the organized ecosystem, in the education, in clear roles, in methodology in general, we need to make sure everything is aligned. The other important thing is a blue circle around. It's the framework conditions. And there you see the funding mechanism, but the complexity is already mentioned by Tom as well. The regulation and the recognitions, of course, to make sure goal-oriented care is possible. Just to show you the complexity, next to Alivia, at the same time, we're doing Belrai. It's the Belgian version of Interrai as a tool. We have the Flemish social protection. It's also a tool, or yeah. We have the Care Atlas. That's a data platform for shared data, more linked to population health management. We have caring neighborhoods as an ecosystem. We have our primary care zones in Flanders as an ecosystem. We have palliative care reform as an ecosystem as well. We have interfederal trajectories, more linked to role defining, but also regulatory in the blue circle. We have care coordination, case management, what we are talking with the whole of Belgium. So that's also a really important one to check out. So it's a big, complex story, but just to finalize this, we hope to use Alivia and all the other projects to move the healthcare landscape towards goal-oriented care. So thank you for your attention.